Alive and Well STL is a presentation of the St. Louis Regional Health Commission and Rare Gem Productions to build a healthier St. Louis. Power up with the positive. Learn more at oneraregem.com. That's ONERAREGEM.com.
Support for Alive and Well STL comes from Beyond Housing, helps entire communities become better places to live. Learn more at beyondhousing.org.
The Regional Health Commission works in partnership with regional health sector advocates and stakeholders to improve healthcare access, reduce health disparities, and improve health outcomes for the uninsured and the underinsured in St. Louis City and County.
Alive and Well STL with Bethany Johnson-Javois, CEO of the St. Louis Integrated Health Network and Managing Director of the Ferguson Commission.
Hello, and thank you for joining us today. I am Bethany Johnson, Managing Director of the Ferguson Commission, CEO of the St. Louis Integrated Health Network as well, and I'm glad that you can join us. Today, we are in studio with Dr. Faisal Khan, Director of St. Louis County Health Department, Department of Public Health, and Melba Moore, Acting Director and Commissioner of Health for the City of St. Louis Department of Health. So thank you both for joining us.
Thank you.
Thank you.
Very excited to have you. I'm particularly excited having leadership from public health. Tell me, what does it mean to you to be alive and well in STL?
You know, I was coming up the elevator and I thought, wow, how thankful I am. You know, all of the people who have set this pathway for me to do something different, I love my community, and to be a part of the design. And the fact that we're talking about being alive and well and what that means, I'm excited about that because you get to share your inner thoughts, not very intimate, but inner thoughts about what that would look like and how you can work with others. So I'm excited.
What does it look like to be alive and well?
You're energized, you're empowered. It's access, it's employment. I'm a part of my community, and I get to talk about making some changes, adding the color to my community, and I'm accepted within my community. And I bring value to my community.
Every day.
Every day.
What are you thinking? That's a good setup for you.
No, I completely agree with Commissioner Moore. I would add, I try to remind myself and those I work with at least once a day about the definition of health. Health is a state of complete physical, mental, social, and emotional well-being of an individual and a community, and not just the absence of disease and infirmity. And if that sounds idealistic, it's meant to be. It is a goal worth achieving. It is a goal worth yearning for. We're not going to get there any day soon, regrettably. We simply don't have enough resources to do that. But I think breaking down each one of those factors that impacts the health of individuals and communities around us is important. They're worth investing in. They're worth working towards.
So as you think about that, it feels like a common definition. I see you nodding your head. How do health departments advance the vision of wellness, being alive, adding the color, adding the zhuzh to our community? How does a department do that? A government entity, funding streams, clunky things happen. Right. So how do you meet that vision?
I don't think it's a role that comes naturally to government entities. You're absolutely right. It requires a level of political commitment and will that, if it is lacking, will prevent that from happening. The St. Louis County administration under County Executive Stenger has issued clear instructions to all departments to engage the community on issues related to health and social, economic determinants of disease. We have recently embarked on that mission. We changed the name of our department to send a clear signal to our staff and to our community. We went from being the St. Louis County Department of Health to being the St. Louis County Department of Public Health. Now that is much more than just semantics for those who are familiar with what public health actually involves. It means involving sectors that we have not traditionally engaged in the health mission. And so things like school systems and housing and building codes and zoning codes and communities that are safe and empowered to make positive social changes are all part of public health. They're part of our mission. But come back to your point about how we go about doing it. I think the one thing that, you know, and I know Commissioner Moore and I completely agree, our departments act as catalysts to bring together to the table all the stakeholders and community partners and other agencies with the resources to make those changes. We have to be the driving force behind that scientific endeavor. We have to get those conversations started with actionable items attached to them and then see them through to fruition.
Thank you.
Collaboration. I was listening to Dr. Khan, and yes, ditto to everything he said. It is about collaboration. It's about us. We are the thought leaders. We touch this stuff every single day. So we need to be able to translate it in a way that's more palatable, easy to understand, and how someone else outside of our arena has a role. So we describe it. We describe the problem. It's science, it's data driven. So that's our role. And we are advocates for our community. We're advocates for public health. You know, the mayor put together the sustainability plan, and one of the goals for the department, you know, we're looking at health disparities, obesity, sustainability. How do we do this? And it's across all of our departments and my sections within the department, and it's looking at how we're going to do this and whom we're going to do this with. We're going to do it with others. It's the community. It's the Miss Johnson down in the 22nd Ward. It's the 27th Ward children that we're going to be working with. It is the school system. Yes. It's the educational system. It's our governmental other city agencies. You can't do it alone, but I will say there's health in all things. Absolutely. And health in all policy.
Absolutely.
That's us.
Well, as I'm listening to your conversation, I'm bobblehead nodding because as I've had an opportunity, a gift, a blessing, to be able to come from the health sector. Public health has been entrenched now that I've been living in one of the departments, actually, our offices, and now going to the Ferguson Commission and seeing how when we try to slice it by isolated scope sector, it does not work. So right. Now, having done this for months, I see myself valuing the public health broader wellness model because, like you said, health is in everything. And if you exclude it, you go into silos. So let me ask you kind of the elephant in the room question. Silos is a big thing in St. Louis. Fragmentation, you know, we could be the best practice for fragmentation. And so the obvious question becomes, both of you are in new leadership roles with great opportunity, but the excuse that you could use to not collaborate is the silo of city and county, et cetera, et cetera, et cetera. So tell me more about your collective vision, given public health as the framework. How can you effectively work together and model that for this region that has such a hard time understanding how to really do this work?
Let me tell you how we have been doing it silently. Dr. Khan is in the county public health department, and I was a commissioner. Sometimes you don't have to talk about it. You pick up the phone and you say, hey, here's what's going on. Our departments work together. Right. We've been doing it. So, and we know that we respect our leadership because there's an agenda. We follow that agenda. We're very respectful. If I'm coming in the county, I will not come in the county and try to inspect something. I'm not in my lane. I need to stay in my car, in my lane. And then when I turn on my signal, that's when I'm calling Dr. Khan and saying, Dr. Khan, can I come in your area? Can we work on X, Y, Z? If he's not available, I understand he's not putting me off. What I understand is that he's busy, he has somebody else, and he's gonna bring one of his subject matter experts to walk with me, talk with me. And that's how we have to work. Right. And I always say to my staff, put the earplugs in when it starts talking about that negativity, because all that does is drain. It's very draining. And that's what we're not about. This is about us working together because we can do things together.
Right, and I second everything that Commissioner Moore has just said, and you're always welcome. And we have an excellent relationship and rapport with our colleagues in the City Health Department. We always have had that. I think we would be remiss in our responsibilities towards the residents of the St. Louis region if we didn't. So even if there are political issues or other structural administrative issues that may be perceived as barriers, at the operational level, both our departments work seamlessly together. There's always room for improvement, and we constantly seek that. But I'll give you a specific example. The St. Louis region is well recognized for several not so stellar health indicators, one of them being sexually transmitted diseases. Unfortunately, we have a disproportionate burden in the region, and we recognize that. We are working diligently with each other, as well as our state partners and our community-based agency partners, to try and address that as a region. And so one of the favorite lines, and I know Commissioner Moore uses this as well, Skinker Boulevard does not recognize the transmission of STDs one way or the other. Right. It really is one huge population that is affected. And so it behooves us to work together and not get caught up in bureaucratic minutiae or administrative barriers.
So what is the common agenda? This show, this conversation, this movement is really talking about trauma, the effects of trauma, and the resilience that comes afterward or during the process. So what are the three maybe common agenda items that you share that really help to advance a trauma-informed community?
When I think about that, common agenda items, we have accepted, and I go back to what I was saying earlier, it's acceptance. Except we have some challenges. Okay. Work together to develop a plan how to do that. And we are doing that within our departments as it relates to violence and sexually transmitted disease. And that regional group is an excellent example of how we can bring this to fruition and bring it forward to address the issues, because we recognize we can't do it alone in a silo. But I think coming together and understanding when you accept an individual, accept a community, you recognize what's there, the strengths that are there. It's our role to pull out those strengths and getting people to be the best that they can be. So I would say for me, the big thing for me is acceptance, accepting where we are, what we have, not settling, and I don't want anybody to think it's settling. It's me respecting and valuing what you bring, the beauty that's in both of these communities. We talk about parks and all of the other things that are in the community, but the people that are in the community, they are valuable, and we want them to be engaged with us.
Yes.
Because we're in this together to make it better. Mm. And I might not know, I might not have all the answers. I can turn to my colleague. We might not understand why the Miss Johnsons don't do or she doesn't do what she should do. But when we engage with her, not judge her, check on her. But I think at a very specific level, we have to check on one another, to check in, are you okay? And to celebrate the things that we have to celebrate about. Both of us are new into this, and I'm excited for you. I'm excited for myself because never did I think, as a little girl, I always had a dream as a little girl, and we won't go into that, but I had dreams and aspirations, but I never thought I would be here. I love the politics of things, And I love sharing my experience with my colleagues and with my staff so that they can be better and that they cannot be afraid of what it is.
And seize this moment.
And yes, this is an
Right.
opportunity, a golden opportunity for us.
What's your reaction?
I agree. I think that's very profound. We have tremendous resilience, strength, and tenacity within our community, despite everything that we are confronted with. I think Ferguson, the events of Ferguson post-August last year, after Michael Brown's death, were a symptom of a community that has experienced a toxic amount of stress. And I repeat this every opportunity I get because I think it's important to do so. But it brings to light a number of issues: under-resourced and weak school systems, a lack of employment, concentrated poverty, a lack of transportation, the absence, in many cases, of safe, healthy, walkable communities, the complete unavailability, in many cases, of healthy, nutritious nutrition options, leads to a fatalistic attitude in individuals and communities. We don't have control over everything. We do not control anything about our lives. We are on a downward spiral, and so forth. And when that anger exploded on the street, my question to my colleagues was, do you see public health intervention opportunities here? And sure enough, when we began to make a list, it was everything that Commissioner Moore has just pointed out. So, it would be one thing for me to say public health only touches upon healthcare and preventive services.
Right.
Unfortunately, now there is no choice. You either, if you're going to succeed as a Department of Public Health, you better be willing to engage proactively on all these fronts. You better be willing to invest your money, your resources, whatever you have available in addressing all these issues. The one thing that I use to inspire myself and my colleagues is the words of Martin Luther King. Of all forms of injustice,
Yep.
inequality and disparity in healthcare is the most shocking and egregious. And that is true. That is absolutely true. I think if I were to tease apart the words healthcare, I would include everything across the board. It is shocking when certain zip codes in North County have an average life expectancy for an adult African American woman at 56, and the same for Far West County is at 90. That 30-plus year age gap didn't just open up overnight. We allowed it to happen. We allowed these concentrations of poverty, these disenfranchised, marginalized communities to grow and flounder on their own. So Ferguson really, I think if there's one thing that is an absolutely vital lesson for everybody to learn, is that it brought to the surface a lot of these issues.
And to your point now, disregarding history and blame of the past, the statistics with which we are living are happening now on our watch.
Absolutely.
So now that it is our inheritance, the next question becomes, what is the call to action in this space and time and moment with which we need to engage? So with that, in closing, the way I'd like to do this is to ask you to do this exercise with me. I want you to sit straight up in your chair, and I want you to close your eyes. I want you to forget about the room and the mic directly in front of your lips. And I want you, from a positional place of the authority that you have been gifted in your roles as directors and leaders, and the dream, Melba, you had as a little girl, and now you're walking in the realization of it. And I want you to make a clarion call with the authority in your voice to those listening and looking today. What is the call to action that you have in this defining moment for our community?
I would say redirect all available resources where they are needed most for the issues that have come to light in the St. Louis region to address all the disparities that we have talked about today.
I stand here to be the change that my community needs. I stand here and I ask that my community, that my colleagues, that we work together to redirect those resources, that we're honest, that we're fair, and that we're just. And that we call for the change, and we don't stop until that change has happened. And that's all of us working together. All of us working together. We have to do it. This is ours. And the last thing I have to say is, I'm sorry. I'm sorry that it didn't and that it is like this. But we're going to make this better because we're going to do it together and we're going to make it happen.
We're going to take a deep inhale right at that. Real deep inhale and a real deep exhale. And what we put in the atmosphere becomes truth and it starts moving. And on that note, we thank you for coming.
Thank you.
We thank you for your thoughts and we thank you for your reflection. This is the appointed time.
Yes.
Absolutely.
And things are moving. So I want to thank you both. Are there any other closing comments you would have before I transition out?
No, thank you so much for listening to us, and we look forward to working with you.
Thank you, Bethany. And thank you,
Absolutely.
Dr. Khan.
Thank you, Commissioner Moore.
Thank you, everyone, for joining us for another episode of Alive and Well STL. We look so forward to speaking with you again next week. And for more information about Alive and Well STL, follow us on Twitter at Alive and Well STL or visit us online at aliveandwellstl.com. Thank you.
If you, your family, or your organization is interested in talking about how we better the well-being of the region, sign up for more information, join the conversation, log on to aliveandwellstl.com, and let's build a plan on how we can work together and improve our overall health and become alive and well.